Hello, my name is Oloremi Akintola, and today I will be presenting my evidence-based practice project titled The Impact of Culturally Competent Care on Treatment Adherence Among African American Pregnant Women in Urban Obstetric Clinics. This project aims to explore how culturally competent care improve treatment, adherence, and outcome for African American women in the urban settings. Let's dive into the details of this proposal. The purpose. This project aims to investigate how culturally competent care can positively impact treatment adherence among African American pregnant women in urban obstetric clinics. Treatment adherence is crucial to maternal and fetal health. We can improve health outcomes and reduce disparities by ensuring that healthcare providers understand and integrate cultural beliefs into their care. Literature review, background, and significance. Research has shown that African American women face significant health disparities in maternal care, including higher rates of maternal mortality and preterm birth. One contributing factor is the lack of culturally competent care, which can affect treatment adherence. Studies suggest that when healthcare provider understands and respects cultural differences, patient satisfaction and adherence to medical advice improve. The significance of this project lies in addressing these gaps and improving the overall health of African American pregnant women. Proposed change or intervention. The proposed intervention is to implement culturally competent care training for healthcare providers in urban obstetric clinics. This will include cultural awareness training, providing culturally tailored health education materials, and improving communication strategies to build trust and engagement with patients. The goal is to enhance treatment adherence and improve maternal health outcomes by meeting the unique cultural needs of African American pregnant women. How guided by the evidence-based project model? I will be using the Iowa model of evidence-based practice to guide this project. This Iowa model helps identify clinical problems, gather evidence, implement changes, and evaluate outcomes. For this project, the problem identified is poor treatment adherence among African American pregnant women. To evaluate this project's success, we will gather evidence on the benefits of culturally competent care, implement the intervention, and measure improvement in treatment adherence and health outcome. The setting for this study will be urban obstetric clinics serving predominantly African American populations. Ethical considerations will include informed consent, confidentiality, and voluntary participation. Data will be collected through surveys on treatment adherence and interviews for qualitative feedback. The study will also ensure reliability and validity by using validated tools such as adherence scales and cultural competence questionnaires, with a pilot phase to test their cultural relevance. The outcomes. The primary outcome of this intervention is improved treatment adherence among African American pregnant women. Secondary outcome will include increased patient satisfaction and better maternal and fetal health outcome, such as reduced rate of preterm birth and fewer complications. Data will be collected using self-report adherence questionnaires and chart reviews to track health outcomes. The outcomes. The primary outcome of this intervention is improved treatment adherence among African American pregnant women. Secondary outcome will include increased patient satisfaction and better maternal and fetal health outcome, such as reduced rate of preterm birth and fewer complications. Data will be collected using self-report adherence questionnaires and chart reviews to track health outcomes. Significance to the field of nursing. This project holds great significance to the field of nursing as it addresses key health disparity and emphasizes the importance of culturally competent care. By improving treatment adherence through cultural relevant approaches, we can make a tangible difference in the health of African American pregnant women. Additionally, it enhances nursing practice by equipping nurses with the tools and knowledge to provide culturally sensitive care that leads to better health outcome. Innovation. The innovation aspect of this project lies in its focus on culturally specific interventions in an urban clinic settings, targeting a population that has been historically undeserved. This approach combines both quantitative and qualitative methods to measure the effectiveness of culturally competent care, which may lead to a broader impact in reducing maternal health disparity. If successful, this model could be adapted for use with other minority populations and healthcare settings. Thank you for your time and attention. This concludes my presentation on the impact of culturally competent care on treatment adherence among African American pregnant women in urban obstetric clinic. I believe this project has the potential to improve maternal health outcome and reduce disparity significantly. I welcome any questions or feedback. Thank you.